The DOT drug test hasn't changed much in years, but drivers still get caught off guard by what's on the panel. Let's walk through exactly what gets tested, what the rules are, and what you need to know before you step into a collection site. The standard DO drug test screens for 5 categories of substances. Marijuana, specifically THC metabolites, and that includes every cannabis product out there. Cocaine and its metabolites. Amphetamines, which covers amphetamine, methamphetamine, MDMA, and MDA. Opioids, and phencyclidine, better known as PCP. That opioid category is worth a closer look. Back in 2018, the panel expanded to include semi-synthetic opioids, hydrocodone, hydromorphone, oxycodone, and oxymorphone. If you're taking any of those by prescription, that matters. We'll get to that in a second. First, marijuana. This is probably the most common source of confusion right now. California has legalized recreational cannabis. A lot of states have. It doesn't matter for DOT purposes. Marijuana is still a Schedule I controlled substance under federal law, and DOT drug testing runs on federal rules. A positive THC result is a violation. Full stop. No exception for medical marijuana cards. No exception based on your state's laws. THC metabolites can stay detectable in urine for a long time, and how long depends on how often you use and how your body processes it. If you have questions about your specific situation, talk to a DOT-certified medical examiner, not a general search engine. Now, prescription medications. The DOT panel doesn't sweep for every drug in existence. It tests for those 5 categories, but if your prescription falls into one of them, an opioid pain reliever or an ADHD medication with amphetamines, for example, it can show up as a positive. That's where the medical review officer comes in. The MRO will contact you to verify your prescription before anything gets reported to your employer. Having a valid prescription doesn't automatically clear you. The MRO has to determine whether that medication is consistent with safe driving. The smart move is to talk with your DOT medical examiner about any medications you're taking before your physical, not after. The testing process itself follows a strict chain of custody procedure. Your urine sample goes to a SAMHSA-certified lab. If the initial screen is positive, they run a confirmatory test using gas chromatography mass spectrometry, the gold standard for accuracy. Then the MRO reviews the result before it ever reaches your employer. And drug testing isn't just a one-time thing. You can be tested before you start a job, randomly throughout your career, after a qualifying accident, on reasonable suspicion, or as part of a return-to-duty process. The one thing to take from this: know what's on the panel before test day, not after.